Good morning, good afternoon, and good evening to everyone joining us. My name is Angelica Mangas. I'm a doctoral student at Johns Hopkins University and one of Pacific Forum's young leaders. I'm pleased to welcome everyone to today's conversation series hosted by Pacific Forum in cooperation with the U.S. Embassy in Manila and the Philippine Foreign Service Institute. Today's discussion is called Beyond Vaccine Diplomacy, the United States and COVID-19 Recovery in the Philippines and Southeast Asia. This discussion comes at an important time in the Philippines and in Southeast Asia as countries navigate the problems of social and economic recovery, even as the virus takes new forms. Moreover, the emergence of new variants highlights the importance of emphasizing international cooperation to meet COVID-19's continuing challenges. We are fortunate to hear from highly distinguished speakers today, and it is my honor to introduce each of them briefly. In honor of presentation, we will hear an opening message from Ms. Heather Variava, Chargé d'Affaires at Interim at the U.S. Embassy in Manila since September 2021. She is a career member of the Senior Foreign Service and previously served as Chargé d'Affaires and Deputy Chief of Mission at the U.S. Embassy in Indonesia. After her message, we will hear from two fantastic live guest speakers. First will be Secretary Carlito Galvez, Chief Implementer of the Philippine National Task Force for COVID-19, part of the Interagency Task Force for the Management of Emerging Infectious Diseases. He is also known as the country's vaccine czar. He was previously presidential advisor in the peace process and chief of staff of the Armed Forces of the Philippines. Secretary Galvez is followed by Dr. Yanzhong Wang. Dr. Wang is a professor and director of global health studies at Seton Hall University, the first academic concentration in U.S. international affairs schools to address the security and foreign policy aspects of health issues. Dr. Wang is also a senior fellow for global health at the Council on Foreign Relations and the founding editor of the journal Global Health Governance. So we have a truly fantastic lineup today. Before we start the presentations, I'd like to invite our audience to send in their questions and comments in the interest of having a lively discussion. I also want to remind everyone that all comments are public as we are streaming live through Zoom and on Facebook. On that note, let's hear our opening message from Chargé d'Affaires Heather Variava.
Good morning from Manila to all of you tuning in from across the globe. My name is Heather Variava, and I am the Chargé d'Affaires here at the U.S. Embassy in the Philippines. Throughout this pandemic, the United States has worked closely with our Philippine partners to protect public health, and we will continue to do so as the country moves forward. To date, the United States has facilitated the donation of more than 29 million vaccines to the Philippines through COVAX, including more than 18.8 million doses made available by the American people. In addition, we have provided more than 1.9 billion pesos in COVID-19 assistance to the Philippines to support testing, training of health workers, and essential equipment. Just last week, I was in Mindanao to hand over ICU beds and vaccine cold storage units at the launch of Davao City's community-based COVID-19 response. We are also supporting emerging leaders across the country to implement programs that address the impact of COVID-19 in their communities. In the Philippines, increasing vaccination rates have helped reduce new COVID-19 infections, making everyone safer. This means that while we continue to focus on the immediate threats of the pandemic, we are also able to plan for the future. The COVID-19 pandemic has shown us that public health, economic development, and good governance are all closely connected to one another. Our global recovery from the pandemic must be an inclusive recovery that takes into account economic development and democratic participation. COVID-19 has tested us all, but we have responded together to fight the pandemic. Global public health requires collective action, and the United States will continue to work with our partners to end this pandemic and chart a new course for global recovery.
Okay, so that was a really wonderful message to get this conversation going. And I think without further ado, I'll turn over to Secretary Galvez. Sir, you have the floor.
My highest courtesies to Her Excellency Heather C. Barriaba, Charge d'Affaires of the U.S. Embassy in Manila, Dr. Yan Xiong Huang, Professor, Director, Center for Global Health Studies, New Jersey, and Senior Fellow, Global Health Council on Foreign Relations, Madam Angelica Manghas, John Hopkins University School for Advanced International Studies, my fellow public servants, my friends, diplomatic friends, ladies and gentlemen, good morning. Ladies and gentlemen, good morning. I'm deeply honored to present you today the updates on the Philippine National Vaccination Program and how our bilateral and multilateral partners are helping in our country's effort to address the challenges caused by the COVID-19. Let me first take back on how was the Philippines prior to our first reported case of COVID-19. The Philippines has a population of 110 million situated across more than 7,000 islands of the country. The archipelagic feature of our nation also poses huge challenges in our relief and response efforts, especially in this time of pandemic. Moreover, our healthcare system is not ready for the pandemic works. It is fragmented at the regional level. In order to immediately respond, the PH government came up with the National Action Plan. The National Action Plan against COVID-19 is a four-phase approach that focuses on three factors: the health, economy, and immunization. The National Action Phase 1 focused on the containment and prevention of the virus through strict community quarantine, elimination of the threat by providing medical treatment and interventions, and mitigation of the negative effects of the pandemic. The NAP 2 and the other succeeding NAP primarily focus on the balancing of health and economy, and at this phase, the prevention, detection, isolation, treatment, and recovery strategy was institutionalized along with the zoning containment strategy on the local regions. The Philippine National Deployment and Vaccination Plan outlines a whole of government, whole of nation system approach, whole of society in securing and delivering safe and effective and accessible vaccines for all Filipinos. For this mission, the National Task Force Against COVID-19 has 6 task groups under the vaccine cluster that will ensure seamless and efficient implementation of the historic massive inoculation program. This task group includes scientific and evaluation selection, diplomatic engagement and negotiation, procurement and finance, cold chain and logistics management, immunization program, and demand generation and communication. We recognize the importance of formulating a policy prioritizing the vaccination of the most vulnerable sectors in the society, at the same time preserve our healthcare system. To counter misinformation, we strengthen our information dissemination campaign to explain to the public that all COVID vaccines are safe and effective in preventing severe to critical cases, hospitalization, and deaths. And the US government has given us a lot of support through US aid on this. We managed to bring down our COVID-19 cases to below 500 cases for almost 20 days now. This is definitely a huge improvement when the country was experiencing a surge in cases in August and September due to the Delta variant. And during the time, our daily caseload soared even above 20,000 cases. The gains we achieved in our vaccination program inspired us to hold what we call the National Vaccination Days. The event's main objective is to ramp up the country's vaccination throughput, especially among the vulnerable sectors and regions with low vaccination rates. In total, the Philippines was able to administer over 10.2 million vaccine doses in a span of 5 days. The first leg of our National Vaccination Days was a resounding success, and that is why we are launching again this week its second leg starting tomorrow, December 15 up to December 17. The targets we have set next year reflect our expanded vaccination coverage, since we hope to achieve our goal of fully vaccinating 54 million Filipinos by end of 2021. We aim to increase this figure to 77 million by the first quarter of 2022. In November, we started the administration of booster shots to our general adult population. We shall continue to administer these booster shots until next year. Within the second quarter of 2022, we hope to increase our fully vaccinated individuals to 90 million, and we were able to transition our government by the third quarter, wherein we plan to transition to the next presidency. The long history of friendship and collaboration between the Philippines and the United States has made a significant impact on the Philippine COVID-19 response efforts. The assistance extended by the United States in strengthening our healthcare system capacities and our healthcare workers and equipping for our agencies much needed technical support in terms of logistics, supply chain management, and communication have been very instrumental in more effective implementation of our PDITRB strategy. More importantly, this alliance has provided the Philippines with much greater access to life-saving vaccines. And we thank Charge D'Affaires Variaba for all the help that she had facilitated for us. The Philippine vaccine portfolio is composed of 8 brands. To date, our country has received 158.54 million vaccine doses, and we will be receiving a remarkable 24 million in a day today with the COVAX facility and our procurement. We expect the supply to increase significantly in the coming days as manufacturers have confirmed to ship out larger shipments towards the end of the year. The COVAX Gavi CEPI initiative, which is supported by many countries and organizations around the globe, has assured us of donated vaccine supply equivalent to more than 30% of our population, or around 44 million doses. Our partner nations also directly ship their vaccine donations, which include Japan, United Kingdom, UAE, Brunei, Russia, Poland, Australia, and South Korea, and China, have given us huge amount of bilateral donations. All in all, we are able to secure more than 217 million doses of vaccines from these various sources. We are thankful to vaccine manufacturers, the private sector, and local government units, as well as our friends from the international community for making this life-saving vaccine available for us to all Filipinos for our inoculation program. The United States had been a vital partner to the COVAX facility and other nations that benefit from the facility support. The US has pledged to donate a total of $4 billion to the COVAX, a truly outstanding figure that demonstrates the United States' commitment to the Philippines, its partners and allies, and the entire world. Out of the 44 million doses committed by the COVAX facility, 37.4 million doses have already been delivered to the Philippines. Of this number, more than 18.83 million doses were sourced from the US COVAX sharing donation agreement, and these were direct donations from the United States to our country. We are also expecting 10.2 million Pfizer delivery starting this December. The 3.6 million doses of Johnson vaccines donated by the United States last July was the first batch of Johnson & Johnson vaccines that our country received. These much-needed vaccines were specifically allocated to individuals that needed them most: the senior citizens, the indigent population in vulnerable communities, and the geographically isolated and disadvantaged areas. From helping to augment our medical supplies and equipment, different hospitals and health facilities across the country, to capacitating our healthcare workers and medical frontliners through training and workshop, to helping strengthen our communication capacities, as well as in providing technical assistance and support in our supply chain management, the United States Embassy and the US Aid have been a tremendous help to all of us Filipinos. As a global community makes the safe transition to the new normal and learns to live with the virus, we look forward to the strengthened and enhanced cooperation between the Philippines and the United States, particularly in the areas of health and economic development. By standing side by side and working together, we are stronger. We look forward to forging partnership with the US, especially in the fields of biomedical research and public health. After all, public health is a global concern. In summary, The deeply rooted friendship and diplomatic relations between the Philippines and the United States, as well as with other nations, have enabled our country to gain greater access to safe and effective vaccines and implement a more effective pandemic response. While many countries, including the United States, heeded to our call for equitable access to these life-saving vaccines through COVAX facility, much work still needs to be done to keep every person in the world safe from COVID-19. No one is truly safe until everyone is safe. Lastly, the strong synergy between the national government, local government units, the private sector, and the international community, particularly US, is because we all share a common goal. Thus, our efforts to combine strategy, science, the art of operation, integrated resources, risk management, logistics, health response, and communication have been the key in the successful implementation of our COVID response effort. Before I end, please allow me to reiterate President Rodrigo Roa Duterte's comments during the recent ASEAN-US Summit, expressing appreciation for the United States' generous offer of vaccines to the Philippines and the entire Southeast Asian region. We will absolutely never forget the compassion and kindness shown by our American partners during this most challenging chapter of human history. Ladies and gentlemen, as we welcome the holiday season and the new year, let us be reminded of the power of unity and collaboration. Indeed, if we all come together and united behind a common goal, we can overcome all the challenges that come our way. Thank you very much and have a good day. Madam Heather, thank you very much for all the support. We will never forget your kindness. Maraming salamat po.
Thank you very much, Secretary Galvez, for your illuminating marks. It's really encouraging to hear about the progress that has been made, especially with the vaccination rates and how well that the national vaccine days are going. So good luck to that effort. I'd now like to invite Dr. Wang to give his remarks.
Thank you, Angelica. Secretary Galvez talked about the Philippines vaccine rollout. I congratulate him on the great efforts the Philippines being made in combating COVID-19 under his leadership. So I'm going to talk in not sort of more general terms on the vaccine rollouts, vaccine diplomacy in Southeast Asia, although I'm going to also use the Philippines examples here. So if you look at the region as a whole, right, it's very clear, right, that Southeast Asia has become a strategic arena for Washington and Beijing, right? It's a regional priority for both countries' vaccine diplomacy, right? To my knowledge is that the U.S. Secretary of State Antony Blinken has made a strong commitment to Indonesia and also the region as a whole when he kicked off a Southeast Asia trip, that aimed at strengthening ties with the region. And China also has the senior diplomats, leaders visiting the region. And in terms of the vaccine diplomacy, if you just compare, right, the donations that pledged, right, to the region, the United States and China actually are donating a greater share of vaccines to the region, despite lower case burdens there, right? This region, I think, account for, as of November 17th, account for like 5.4% of the global cases. But it's clear, right, is a key target for Chinese vaccine diplomacy. Chinese vaccines, I think, that goes to the region account for 29% of China's total vaccine donations, and then 26% of its vaccine sales worldwide. Right? And so Southeast Asia is clearly the preferred region for China's so-called Health Silk Road construction. Indeed, as of early December, 40% of the Chinese vaccines delivered overseas went to Southeast Asia. And on the US side, by September 2021, the United States has donated approximately 140 million doses to at least 93 countries. But if you look at the top 10 countries receiving the most doses, 3 are in Southeast Asia. They include the Philippines, that received 6.4 million, Vietnam, 5 million, and Indonesia, 4.5 million. Right? So the 3 countries, right, accounted for more than 10% of the US donations, by September 2021 already. And certainly when we talk about US-China competition, right, China has this first mover advantage. Their consistent supplies, when the Western countries were hoarding the vaccines, right, practicing the so-called vaccine nationalism. But the United States might soon sought to counter Chinese influence by building the Quad partnership with Australia, Japan, and India, but that aimed to provide 1 billion doses to the region in 2022. But the problem is that China has been slow, right, to sell the vaccines. The Quad plan, right, they essentially stalled after India, right, because its own the spike of cases, right, in early spring. Right, they banned exports in April, right, and only recently they agreed to export the first 8 million doses, right, in October, right. And China, so China continued until recently dominated the vaccine rollout efforts in the region, with some countries like Indonesia, essentially 80% of their vaccines, right, made in China, right? And I believe Cambodia might receive more than 80% of the this vaccination rate, but largely because of the vaccines supplied by China. And if you look at the patterns of their vaccine diplomacy, right, US donations are primarily moving through COVAX, as the Madam Chargé d'Affaires just indicated. But the United States is earmarking where doses will go even through COVAX. Right? Beijing essentially distributes vaccines directly to its recipient countries. Right? Only 10 million actually are through COVAX. Right? And some of these donations in Asia have occurred in politically charged contexts. Right? Philippines, right? According to President Duterte, right, he claimed that the US vaccine essentially convinced him not to cancel the US-Philippines visiting forces agreement. And in Vietnam, by the US Vice President Kamala Harris donated 1 million doses there during a bilateral meeting with the Vietnamese Prime Minister. And immediately, right, that when China learned about that, the donated, pledged 2 million doses to the country. So what's the outcome of this competing vaccine diplomacy in the region, right? Again, but this far, China still dominated, right, the market in the region. But beginning, I think, in the summer, right, many countries are moving away from the Chinese vaccines, especially when they considered using the Western vaccines as booster shots. The as the Secretary Galvez made it very clear, right? The Philippines, right, they essentially use vaccines, in addition to China, they also use vaccines from US, Russia, and India, right? But the problem is that US continue to be slow in delivering the vaccines. That is not helping, right, the US expanding its influence in the region. That the reports, say that many of the Southeast Asian countries reluctant, to be critical of China because they're concerned about the slow delivery from the United States. But it remains unclear that Beijing is indeed getting its way through the vaccine diplomacy, right? In part because, again, as Secretary Galvez indicated, right, many of the Southeast Asian countries are diversifying the supply of their vaccines, right? They do not want to take sides, right? It is interesting, right? That just that when Manila, for example, in March, right, they continue to buy the vaccine, to use the vaccines from Beijing, or they signed a deal, right, with India, right, to buy the cruise missiles, right, from New Delhi, while also by trying to secure vaccine doses from India and the United States, right? So there's no indication that despite Beijing's vaccine diplomacy, right, that Manila is actually softening, right, its stance on its territorial disputes with China. So this is the I think now we're talking about beyond the vaccine diplomacy, right? Now I think we are in a era with a lot of uncertainties, right? Because while many countries, right, they still have a relatively low percentage of the population fully vaccinated, but this include, right, the Indonesia, Philippines, Myanmar, and Laos, but we are concerned about the arrival of the new variant, potentially that is more transmissible, than the Delta variant. But in the meantime, but this is how it all complicates the picture. That in countries that have a low vaccination rate, actually their cases have dropped significantly, right? The Philippines is a very good example, right? Even though they have, I think until recently, they have 38% percent of the population fully vaccinated. But if you look at the new cases count in the country, right, it's December 12th, but this is the 7-day average is only 260, right? So even with a relatively low vaccination rate, actually Philippines doing much better job than many of the Asian countries in terms of bringing down the cases, right, in the country. So, that I think is going to make this landscape of the future of vaccine diplomacy, right, even more complicated. So with that, I'm going to stop there.
Okay, wonderful. Thank you so much, Dr. Wang, for your remarks. Also extremely informative and educational. And I think at this stage, I'm going to open the floor. Well, I'll start with a couple of questions of my own, and then I'll open the floor to general questions from the audience. And again, I just want to remind the audience that you have two ways of asking questions. You can use the raise hand function here in Zoom, and I will call on you and you will get to say your question out loud. Or you can wait to be called, after which you will wait to be called, and then to please identify yourselves. But alternatively, you can also post your questions on the question and answer tab, and I can read your questions out. So whichever way you're more comfortable, get those questions in. And there's a big discussion, I think, to be had here about vaccine diplomacy and beyond that, COVID recovery in the Philippines and Southeast Asia. So to start off with questions, I'm most curious, and this is a question a little bit different for each panelist, but I'm really curious about new strategies. And the ways in which countries are responding to new variants or different rates of infection, I think that they've changed since the pandemic first started in early 2020. And there's been a lot of recent discussion in the region, but also outside the region, about keeping or abandoning zero COVID strategies. And so the Philippines in the past was known for having a particularly strict approach, right? Although I saw from the NAP that Secretary Galvez presented that we're in the phase of learning to live with the virus. So my question for Secretary Galvez is, how do you see the Philippines adapting its approach to managing life with the pandemic? Are shutdowns or curfews the way we used to have them? Are those the way of the past? Or if not, what do you think it will take to get to that stage?
Yeah, many people even wonder why we are only at 37% fully vaccinated. But our strategy is always we called it centers of gravity, meaning we focus our early vaccines to the centers, meaning to those areas the most vulnerable, and also those areas we consider transit points. So we form some sort of NCR +8. So we concentrated most of our vaccines to NCR, and I think there is no country that we have a major city of more or less 14 million that are now 100% fully vaccinated. So we are now expanding it, and we have seen that more or less 10 of our cities already 100% vaccinated. Though the other areas are relatively low. We saw that there are many 15,000 barangays are unaffected. So meaning we concentrate more our vaccines to those mostly affected areas. So we are now good considering that most of them are 70% fully vaccinated. Second is we are looking at the granular employment of lockdowns, meaning those cities, those barangays, those streets, those houses that have COVID cases. Those are the things that we are locking down. We are not locking down provinces anymore. We're not locking down cities. We're not locking down. We are only locking down streets, blocks, and also houses. So that's what we have done today, and we are now also venturing on the alert system, wherein the alert level of 1 to 5, meaning with those systems, we have some sort of prearranged response scale. So meaning we already have some sort of automatic response for every alert level that we have, and we are doing a lot of some sort of strategies. Our strategies of prevention, detection, isolation, and treatment, and also recovery, paved the way for a good numbers that we had. So we concentrate more on prevention by maintaining the minimum health standard, strong border control, and also strong discipline among people. So our PNP, our police, and the armed forces, and the DILG are enforcing the masking, and also the private sector also written their protocols so that only vaccinated people can enter closed space and also dining. So those are the strategies that we are making now. So the good thing in the Philippines is the private sector, the local government units, and also the national government has some sort of triumvirate strong relationship that enforce and implement the IATF resolutions very faithfully.
I think that center of gravity approach is actually very interesting, and I'm not sure that I've seen other places that have that kind of approach. Dr. Huang, do you have any insights over adaptive strategies elsewhere in Southeast Asia? I'm curious if you know anything about the things that other countries are considering when they're figuring out how to live with the virus that might be underappreciated outside the region.
Well, if you just we talk about this zero COVID strategy, right? I think it makes sense, for countries to adopt such approach, especially when you don't have access to the vaccines, right? So many of the Asian countries, I would suppose, to adopted that approach, right, in responding to the pandemic. But when the vaccination rate reached a certain level, and I think also when the zero tolerance strategies increasingly by showing the diminishing returns problem in terms of the cost, right, incurred, and also in terms of the difficulty of eliminating the cases, right? Then I think it makes sense to have an exit strategy, right? This is what I think Singapore has been doing, right? But of course, but that process, but it's not the decision is not an easy one to make, right? In Singapore, for example, even though they have like more than 80%, right, this vaccination rate, still, right, when they move away from the zero COVID strategy, right, immediately it's followed by a spike of cases, right? And only recently we have seen a drop, right, of the cases, right? So that short-term pain, right, this also sort of deterred China from abandoning the zero tolerance strategy, right? That they continue to cling to that strategy, and to a less extent, I would say Taiwan would be another, right, that still cling to that strategy. But if you look at the countries, most of the countries that had adopted that strategy now have been either moving away from that approach or considering a pivot. Right?
Excellent. I think we have a question now from another young leader, Jay Tariela. Jay, please go ahead.
Hello, Jika.
Yep, I can hear you.
Thank you, Jika. Thank you, Secretary Galvez, sir. Thank you, Dr. Wang. I'd like to ask Secretary Galvez if we could recognize this vaccine donation of the U.S. government as a sign of good gesture from its oldest ally, or as a means to have a compromise of retaining the visiting forces agreement. Considering that the president also mentioned this last August, that he chooses to keep the U.S. military deal as a concession for vaccine donation coming from the United States. And then for Dr. Wang, I would like to know his insights if we could say that this donation of vaccines, not just in the Philippines, but in the region, as a counter response to the early onset of vaccine diplomacy of Beijing. Related to my question to Secretary Galvez, can we also say that vaccine donation basically served as a leverage for Washington in the past months in dealing with Southeast Asian countries, particularly the Philippines? Thank you, Jika.
Great. I think Secretary Galvez, perhaps you can go first, and then we'll turn to Dr. Wang.
Yes. As you can see, the vaccine supply that we had during the time of March up to September, we are very short of vaccine. With that, I talked to the U.S. Embassy, but I really beg for their help so that our vaccine program will push to its maximum. So during our meeting with our dinner meeting with then charged the affair, John Law, because we have a good relations with John, and we really thank him that our appeal of really having some sort of additional vaccines have became a phenomenal success when he responded that we will bring Johnson & Johnson's and also later Moderna and even Pfizer in the next one. And we are very thankful that after that, there is some sort of rippling effect that other countries also donated to us because they saw that our cases are surging. Delta is raging over us, and they have seen that there are many casualties and many deaths that really appeared in the media. And with that, I believe that the pleading that we made to the other countries have made us successful. And also during those times that we have some sort of a very difficult time on the negotiation with Pfizer. Also, the U.S. Embassy in the Philippines really helped us a lot in order to iron out and to give more access on the 40 million vaccines that we have. Basically, I can say that the diplomatic relations, the strong diplomatic relations that we had with the U.S. have paved the way for that access. Notwithstanding also the BFA. Actually, the BFA is only a side, but really the one thing that we really make us is the strong relationship between the military. I'm being a military. I have good relations with our diplomats, especially our U.S. counterparts, and we have a good relations with Janbo, and now we have good friendship with Mama Pariaba, and we are thankful that the U.S. maintains a good relationship and good standing on really giving us the access.
Dr. Wang, how about your question?
I want to make sure I understand the questions correctly. We're talking about the U.S. vaccine diplomacy trying to counter China's influence. Is that what you are talking about?
I think his question, well, I'm not sure if he's still there, but I think his question was, do you think that U.S. vaccine diplomacy was in part influenced by early Chinese vaccine diplomacy?
Yeah, well, absolutely. I think that's the, if you look at the rationale for U.S. launching its own vaccine diplomacy, I think it's largely motivated by Chinese vaccine diplomacy, right? The U.S. the foreign policy makers, right, do not even try to hide, right? There's is the intention, right, of U.S. vaccine diplomacy is to counter Beijing's influence. All right. Most certainly, right, that for Southeast Asia, when you have two countries, right, two superpowers competing with each other, right, sending vaccines to the region, actually, Southeast Asia is a beneficiary of that competition, right? So, but keep in mind, right, they've become a beneficiary, right, because this is considered strategically important, right, this region. So considering, right, that even though, right, this region, right, has the relatively lower case burden, right, but still receive, right, a greater share of the vaccines to the region, right? You can tell how this vaccine diplomacy, in a way, sort of distorted, right? This global objective of having great global equal access to the vaccines, because, right, those regions that are not considered strategic important will receive less vaccines, right? So that's what we are seeing in lower income countries, right, which today only have like 6% of their population, fully vaccinated, right? So in a way, this vaccine diplomacy, right, exacerbated the problem of the global equal access to unequal access to the vaccines, in a way also, but defeat the purpose of the COVAX, right? Which try to sort of address this problem of global unequal access to the vaccines.
I think so. I have two questions here that sort of build on that last one. The first, I think, is also for you, Dr. Wang, from Eugene Texon, from the National Security Council, Philippine National Security Council. He asks, how does U.S.-China vaccine diplomacy affect the Chinese promotion of the Belt and Road Initiative or the U.S. promotion of Indo-Pacific Business Forum in the country? So is there a commercial interest here, do you think? Or is this a strategic, or is it a supply chain interest? I think is another way of asking that. And a question here from Meli Caballero Anthony for Secretary Galvez. Could you say something about cooperation among Southeast Asia or ASEAN countries on vaccine access, and distribution? Is there any activity going on in the region? So perhaps Dr. Wang, this time we'll start with you.
Sure, I'm glad that you brought up this Belt and Road Initiative, right? So that is the most important foreign policy initiative China launched in the 21st century, right? And that initiative was launched by actually to help China achieve its geopolitical objectives, right? Through the building of the infrastructure, the projects. But when those ports, airports, right, railroads, right, are used to ship the vaccines, right, the medical products, then it's become part of the like a variant, right, but also important component of the Belt and Road Initiative, what we call Health Silk Road, right? I think the almost all the Southeast Asian countries, right, are considered participants of the BRI initiative. And China, when they are sending vaccines overseas, actually, most of the countries that receive the Chinese vaccines actually are Belt and Road Initiative participating countries. So clearly, right, they have the geopolitical, right, objectives in mind, when practicing this vaccine diplomacy.
Makes sense. Secretary Galvez.
Basically, the ASEAN cooperations during our COVID-19 pertaining vaccine, the only strong agreement that the ASEAN had, I have attended some of the ASEAN meeting. They have some sort of common understanding to have a common voice to gain access, because most of the ASEAN countries are not in the early days, they're not producing countries of vaccines. So what we have done as ASEAN is we created a strong voice for vaccine equity, and also we also thank Thailand, because our vaccines for AstraZeneca came from Thailand, and we are very thankful that despite their domestic needs, they were able to provide us at least 1 million a month, and now they are providing 7 million this coming December. And we thank the ASEAN nations for really relying on our common belief that really vaccine equity is very important. So that voice is very, very important for us, ASEAN, and we were able to gain support from the COVAX. Basically, Indonesia and Philippines are one of the two largest countries who received the COVAX facility, and we thank the ASEAN nation for that having common voice of vaccine equity.
We're getting some questions now related to a little bit on the logistics side, which I think is also really interesting in administering vaccines. One message from Tom Collison says, some countries have had problems utilizing donated vaccines due to logistics, including cold chain transport and storage, as well as vaccine hesitancy. What is the Philippine experience in this regard? I think this is a question for Secretary Galvez. And because there's conveniently a counterpart question, which for Dr. Wang, one here from Kevin Mark Gomez, who asks, is it possible that vaccine diplomacy is not just about strategic importance, but also technical considerations and issues like absorptive capacity, health systems, medical professionals that might be, I think he means, more concentrated in Southeast Asia than in other underserved areas of the world? He asks, in COVAX, for example, current epidemiology is only one factor to be allocated vaccine doses, but the above mentioned are also equally, if not more, important. So Secretary Galvez, perhaps your thoughts on logistics in administering and bottlenecks there?
Yeah, most of the vaccine that the lessons that we have learned from the COVAX is that most of the COVAX vaccines that they're giving us, it has a limited shelf life. So considering that they acknowledge that the Philippines has one of the fastest inoculation, we were able to administer even short life vaccines. For example, they will give us a short life of 2.5 million. And we are very thankful that we have some sort of good and expert inoculators, and we were able to even increase our inoculation previously for 100,000. Now we have some sort of 1 million per day inoculations. And as of this moment, we are very thankful that we are only having some sort of 100, more than 150,000 wastage as of this moment. And we have only recorded for almost 12,000 for expired dosage. So that's why the COVAX is really very generous on providing those vaccines, because they know that the Philippines can use it immediately.
I see. Perhaps just to follow up on that a little bit, what is your sense then of what the biggest bottlenecks are in administering?
The bottleneck that we have seen is at the province and regional level. Considering that in this case, the national election complicates everything, because there's so much division also at the local level. So what we can see is there is no problem from the national transporting it to the different regions and provinces. The problem now is the capacity of the provinces and the municipalities to accept, considering some of the areas, geographically isolated areas, they have limited cold chain facility. So most of the vaccines are being distributed just in time, and also considering also the complexities of those -20, -80, and also the syringes that we will need for Pfizer. The complications really prohibits and challenge the most affected geographical areas. So that's the bottleneck that we are seeing at the municipal, because of the limitation of the cold chain facility and also the transportation. And we are very thankful that the UNICEF is providing, and also the US is providing some cold chain solutions with that, by donating more or less 42 million freezers to those areas.
Could you say something briefly on the part of the question on vaccine hesitancy? Has that been a problem? I noticed you had a slide on that earlier, but how widespread of an issue do you think that is today?
Basically, the hesitancy emanates from the class D and E, meaning those uneducated and those who are on the far-flung areas, wherein the communications and education is very challenging. So also with the preponderance of social media on misinformations, that's really a great challenge for all of us, because they said that when you have the mRNA, you will become a monster, some sort of. So those misinformations can break through to the people in the far-flung areas, wherein we are very challenged, especially in the farm area and those areas in Region 5 and Region 12.
Thank you for answering all of that with the follow-ups also. Dr. Wang.
Well, yeah, I think I fully agree with the Secretary Gavras in that when we talk about the vaccine rollout, it's not just about access to the vaccines, right? It is essentially how to make sure, right, that those vaccines are administered on people, right? So that involves not just the vaccine access, but also, right, the cold chain building, right? The overcoming vaccine hesitancy, disinformation, right? Training of medical professionals, right? To administer the vaccines. But so this is this actually highlights the problems of the vaccine diplomacy, which focuses essentially on, right, the delivery of the vaccines, right, or donation of the vaccines. Very often we even when we talk about, right, the Chinese Health Silk Road, right, during the pandemic, right, we hope, right, in the future, right, they could expand this vaccine diplomacy, right, to provide health-related development assistance in terms of health system strengthening, medical professionals training, the surveillance, capacity, response, the early response capacity building. This all should be, I think, part of this future. Hopefully, this health-related development assistance efforts, by either United States or China. Well, I think this, when we talk about beyond the vaccine diplomacy, I think this should be the direction, right? We want to, the China, United States want to undertake in terms of, health-related development assistance in the post-COVID era, right? So it's definitely not just about achieving, right, geopolitical goals or expanding market share, right? It is about seriously helping building capacities, right, in those countries, right? Especially when we talk about, those early surveillance and response capacities.
I have, that makes sense. I have a follow-up question for you from David Mulliken, who asks, how much is China versus US vaccine diplomacy impacted by the fact that the efficacy of the Chinese vaccines is much lower reportedly than the vaccines developed in the US and the UK?
Yeah, well, so, when we talk about the Chinese vaccines, but they have the Sinovac and Sinopharm's vaccines, both are inactivated vaccines, right? Those vaccines are believed to be safe, but in terms of efficacy rate, well, they are lower. They have lower efficacy rate compared to mRNA vaccines like Pfizer's, Moderna's, the vaccines, and they and that become particularly a concern, right, with the arrival of the Delta variant, and of course now the Omicron, the variant. So Sinovac, in Brazil's clinical trial, they had like a 50% efficacy rate. So that was the ability to prevent infections with the original variant, right? So with the Delta variant, so you can imagine, right, that the efficacy rate will be below 50%. But indeed, there are also studies showing by the antibody levels produced by the Chinese vaccines, like after like a certain period of time, like 6 months, it becomes significantly lower, right? The Western counterparts, even though both like the mRNA vaccines and the Chinese vaccines showing, right, that the waning of the antibody levels, but Chinese vaccines to drop more significantly than the mRNA vaccines. So that might explain why I think in this region, Southeast Asia, they're considering the booster shots. Now they're moving away, from the Chinese vaccines, right, in favor of the mRNA vaccines. So, that was deemed a setback for Chinese vaccine diplomacy, right? President Xi, I believe, has pledged to donate additional 150 million doses to Southeast Asian nations by 2022. But this is essentially, we expect, is going to be the inactivated vaccines, right? But China has been trying to develop its own mRNA vaccines. They have they just announced a clinical trial, the phase 3 clinical trial of its own mRNA vaccines as a booster shots that are expected to end on the end of January next year. I expect they're going to soon approve their own mRNA vaccines, but mostly what given it's this low production capacity that can only meet the needs of their domestic population. I don't expect that they have this, capacity to export, to other countries in large volume, right? Even though their own mRNA vaccines become available. So I expect that the Chinese inactivated vaccines, their share in the global market likely, if this trend continue, will continue to will shrink in the coming months.
Okay, yes, thank you for answering that. I think we're coming to nearly the end of the time. So I think I'm going to ask a last question from our own Dr. Jeffrey R. Daniel from Pacific Forum, who's been waiting very patiently to ask. Jeff, go ahead.
Yeah. Thanks, Dr. Huang and Secretary Carlito Galvez. I'd like to address my question to Dr. Huang. First, there was an article some weeks ago published by the Washington Post, and there was a statement coming from a senior U.S. government official saying that the United States, I'd like to quote this statement, the United States is deeply disappointed that China has provided no financial support to COVAX for vaccinations in low and middle income countries and has chosen to sell its vaccines to COVAX rather than contribute to COVAX financially. So there seems to be a preference for China to make deals bilaterally rather than doing the vaccination assistance for COVAX facility. Is that an accurate assessment? And if so, what is the reason behind this? And my second question is about donations, right? Because there seems to be a notion that China is doing this for sort of geopolitical reasons. But there is a puzzle for many in the Philippines and Southeast Asia when you look at the figures. Because as of October, and obviously this figure probably has changed already, but as of October, out of the 43 million Chinese vaccine doses provided to the Philippines, about 41 million of those were purchased and not donated, whereas the United States has donated 4 or 5 times more to the Philippines. So why is China donating significantly less when it can probably benefit a lot by donating more than the United States? Thank you.
Great questions. Thank you. Right. So to Washington Post article, let me put it this way, right? They have China indeed, right, donating to COVAX, but the number is much slower, right, than the United States. I think they donated only 10 million thus far. But in the meantime, they also contributed vaccines to the COVAX program. So that means COVAX actually buying vaccines from China, right, and then distribute it, right, to the participating countries. So that is why I think Washington Post is like criticizing, right, that this COVAX, right, or China for making money, right, basically in the COVAX the program. And the second problem is that it is true why China has not been providing any significant financial support to COVAX pillar. But that being said, right, it indeed provides some of the financial support through directly to recipient countries, so through bilateral means, right? Some countries, we were told, receive like maybe low interest loans, from China in buying the Chinese vaccines, right? So that may, have some, again, perhaps largely could be attributed to these different ways, of engaging, right, the recipient countries. But China prefers bilateral means, the U.S. right, multilateral means. U.S. well, that leads to the second difference is that U.S. like essentially right provide the vaccines to other countries through donations, entirely through donations. But China largely through the marketing, the means. In fact, I think thus far, only 7% of the Chinese vaccines shipped overseas are through donations, right? So essentially, like more than 90% you have sold to other countries. So that highlights, one objective Chinese vaccine diplomacy, is the commercial interest, right? So the vaccines, the makers, Sinovac and Sinopharm, they not just by the instruments of the vaccine diplomacy to achieve achieve foreign policy objectives of China, but they have their own commercial interests in mind, right, in marketing their vaccines. My assessment is that if you consider like a 40% net profit rate, I think Indonesia, this could be like just an estimate. This is just an estimate, may not be accurate. Sinovac might have raked in like $1 billion, right, from selling vaccines to the country. Okay. So, but because this is just the estimate, could be a lower the actual number. So, one of those commercial objectives, that also set China's vaccine diplomacy, different from the United States.
And I actually, I said that was the final question, but I do have a final question of my own for Secretary Galvez. You mentioned earlier, and I want to pick up on this, and I think it's a nice way to close, which is you said no one is safe until everyone is safe. And I just want to pick up on how the pandemic has exposed maybe some areas of cooperation that were underemphasized in the past in terms of long-term, sort of health investments. And so I'm interested in just some final thoughts from you on what types of longer term or continuing, maybe the better phrase is continuing cooperation you would like to see bilaterally with the United States or multilaterally in public health cooperation.
At the long term, we want to establish health security in the Philippines so that we will be sort of prepared for the pandemic. So our next bilateral and multilateral engagement is more on first, in order our capacity to build our own vaccine through maybe our cooperations with other for fill and finish. And then later also considering that in 1991, our healthcare system has been disintegrated by the local government code. And with that, we want to re-rationalize our health system and also to build our capacity in terms of our commitment on preparing the treatment facilities and also our capacity to respond to scale. Second, our contribution to the world is basically our healthcare workers. We want to expand more on training more healthcare workers so that we can contribute not only to the Philippines but also to the world. Our healthcare workers are being most sought in most countries, and we want to maintain those bilateral engagement that maybe those countries who will be needing these healthcare workers and medical professionals, they will have some sort of bilateral arrangement for us, so that we can have a joint preparations and also enhancement of human resource development that they will be needing in the future. So meaning we want to have some sort of bilateral and multilateral engagement on human resource development on healthcare system.
Fantastic. Thank you, Secretary Galvez. Thank you, Dr. Wang. I really want to thank both of you for sharing, for being very generous with your time, not only in your presentations, but in answering all of the questions that we had come in. So you answered many questions. And I think you really have brought to light a lot of interesting points on how the Philippines has adapted in the last year and will continue to adapt next year in terms of the changing environment for vaccines. Really interestingly, bringing up questions that really I think no one at this stage can answer, which is what happens after the elections and how that environment has changed or how that environment has already affected to some extent how we implement our health priorities now. And thank you also to Professor Wang, especially for bringing to light how important strategic competition has been. It was very enlightening, especially for me to think of how an underserved area can be clearly shown to be, in a way, strategically important just by the disproportionate amount of vaccine diplomacy that's occurred in the region. So again, thank you to both of you. For everybody in the audience, thank you for taking part. And our public session will close now. But I would like to invite our speakers to stay on for our private engagement with our Young Leaders Forum So everybody who's on the, everybody who is, all our participants, we say goodbye to you now. But our speakers, please stay on just for a few minutes as we transition to a private session. Thank you.